Again, magandang tanghalian sa inyong lahat. I am here to present about Philhealth Outpatient HIV/AIDS treatment package. So I am Dr. Remonte, and I work for Philhealth for about since 2017. So this is how I'm going to present uh, the outpatient HIV/AIDS package. So first, let me introduce again where I work. I work at the Philippine Health Insurance Corporation. So it's created to implement the National Health Insurance Program. And our main stakeholders are providers for which we accredit and in turn to for our members to get health services from. In turn, for a set of services that we cover, we pay these providers whenever our members go to them for care. Our members, in turn, are paying their premiums or sometimes being subsidized by other agencies like the government for coverage to the National Health Insurance Program. This year, we implemented the Universal Healthcare Act, which uh, aspires to progressively realize the universal healthcare through systematic approach and clear delineation of roles of key agencies and stakeholders towards better performance in the health system. So, in the subsequent months and years, there will be some changes on how we we engage providers and we pay our benefits because we want to improve the health system to ensure that all Filipinos will have guaranteed access to quality and affordable healthcare goods services and are protected against financial risk. Now let me go first to membership. Currently, we have several categories of membership. So we have the formal members from the formal economy. So these are employed workers who are paying their contribution with counterpart from their employees. We also have those from the informal sectors who are what we call individually paying members or voluntary members. Then we have the sponsored members and indigent members. So the difference between them is that the sponsored members are their premium come from other agencies. Indigent members premium comes from the national government. This is being allocated every year in the national budget. Then we have the lifetime members. So these are our members who have paid 120 contribution and already retired. Then we have the senior citizens whose premium are actually also sponsored by the national government and who are their dependents. So if the children is below 21 years old, legitimate spouse, parents who have reached 60 years old and who are not dependent or who are not and children with disability who even if so a child who is 21 years old, below 21 years old may still be considered dependent of their parents, of his or her parents. How to enroll to PhilHealth? So a person intending to be member should only submit PhilHealth membership registration form. It must be correctly and properly accomplished um, to avoid further uh, problems in the future, such as discrepancies in the information. As a general rule, the corporation will not require other documents, but if there are some discrepancy on or on the information, then the our local health insurance office might ask for additional document like birth certificate or ID. Okay. Currently, these are the premium rates. Okay. But I will not dwell into this right now because this will uh, change in the future. Because in the Universal Healthcare Act, there will only be two types of two categories of membership. Those that are direct contributors who have the capacity to pay their premiums, gainfully employed and bound by employer-employee relationship, or self-earning professionals or individuals. In short, they have the capacity to pay their premium. Then the other category is the indirect contributor, which refer to all others not included as their contributor and their qualified dependents, whose premium will be subsidized by the national government, including those that are subsidized as a result of a special law, like the Senior Citizens Act. And the Universal Healthcare Act also provides that every Filipino citizen shall automatically be included in the okay in the National Health Insurance Program. Okay. Now let me go first with to accreditation. Okay. Okay. Now I will continue with my discussion. Now, um, now let me go to accreditation. As I said, um, so we accredit providers to be able to serve our members. No, in turn, we pay them for the services that we are covering. So there are two main requirements to be able to be paid and be able to reimburse. First, the healthcare institution must be accredited, and the health professional, which is the physician for OHAT, in case of OHAT, must also be accredited. So if if an accredited facility is already accredited by Philhealth, for instance, hospitals, TB dots, clinic, and they are later on designated as HIV treatment hub, then they are not shall no longer apply for separate accreditation. They just have to submit their certificate or copy of a DOH memorandum that includes them as one of the certified treatment hubs or primary care HIV facility, and a new performance commitment. Now, for those that are not accredited, they are a treatment hub recognized by DOH. They have to apply for an accreditation as standalone treatment hub. So what are these standalone treatment hubs? These are healthcare institutions that are operating independently from PhilHealth accredited facility, and but they are recognized as provider of services to PLHIV. So these are the requirements for professionals. So in case your treatment hub doctor is not yet accredited, they have to submit these requirements to PhilHealth to be accredited. Now, these are the requirements for accreditation of the healthcare institution or the treatment hub. Now, for standalone treatment hub, um, even if they are not, uh, even if they are not directly attached to a facility, they must be able to provide the services like monitor laboratory for monitoring drug toxicity and response to treatment, counseling, management based on the current treatment guidelines, prophylaxis, and referral to other services. They must also follow the process of accreditation, for which these are the requirements: performance commitment, provider data record, a fee of 1,000, photos of the facility location map, and the DOH certification as treatment hub, or the latest DOH memorandum. So performance commitment and provider data record are included or are can be downloaded in from our website. Then for renewal, they have to submit this at the start of the year. Now, we accredit treatment hub. Uh, the validity of the accreditation of treatment hub is only 1 year. So the accreditation period is January to December. So come following year, the treatment hub must submit documents for renewal or for what we call continuous accreditation. Now, but for the professional, the accreditation is usually maximum of 3 years. So they have to renew it 45 days before their birthday. Okay. December 2018, we have 86 accredited treatment hubs. Four of them are standalone treatment hubs. Okay. Um, since the Universal Healthcare Act also like classify health services as individual based and population based, and because the objective is really clear to have a clear delineation of roles of the agency, the UHC Act provides that Philhealth shall pay for individual based services, while the Department of Health will uh, take on the population based health services. Okay, so this is the definition according to the Act. Actually, it's based on who receives the health services. So if it's traceable to one recipient, then that's individual. But if the recipient will be the entire population, then that will be population-based health services. Okay. Now let me go to the benefit packages. So the outpatient HIV/AIDS package belongs to outpatient benefits. Now we also have inpatient benefits and catastrophic or what we call Z benefits. So to be able to be eligible not to claim benefits, the members must be registered or a qualified dependent of their member. Then they must have qualifying contribution. So for indigent, sponsored, senior citizens, it's within the validity of their membership. Now for the employed individually paying, right now, the requirement is 9 month contribution out of the previous 12 months prior to availment of benefit. Okay, so this only means in case of shifting from one type of or from one category to another, they were given a 3 month grace period following the month of expiration of the coverage. Okay, last year, PhilHealth launched the expanded primary care benefit for the formal economy, senior citizen, and lifetime members. But these will be revised and further expanded in the subsequent month, to cover for other services. But this is how the process of registration to a primary care provider. Now, let me go to outpatient HIV/AIDS package. The package is 30,000 per year, but can be availed 7,500 per quarter. Um, it only covers confirmed HIV that needs antiretroviral treatment, and the management must be according to the treatment guidelines prescribed by the Department of Health, and it must be availed from accredited treatment hubs. So we cover the tests, diagnostics, the drugs that are not provided by the Department of Health, and consultation and counseling. So again, to be able to qualify or eligible for a hot package, that must be a confirmed requiring antiretroviral treatment availed from an accredited uh, treatment hub and managed according to the policies and guidance on the use of antiretroviral therapy among people living with HIV and HIV exposed infants, as prescribed by the Department of Health. Currently, the filing for OHAT is manual, meaning that you have to submit the paper itself, the claim forms, to our um, Philhealth offices. So these are the requirements. Now, in case the Philhealth benefit eligibility form is obtained from the Philhealth portal, and in case it's already indicated yes, there is no need to submit the assigned CF1. Then also requirement is Philhealth claim form 2 and additional documents about the treatment, no, the HIV treatment, such as copy of the confirmatory result, health regimen booklet, waiver for release of confidential information from the patient. And in case of transfer to one hub, from one hub to another, uh, you must attach a referral letter. Okay, so so this is the HIV or outpatient HIV package. And with that, uh, thank you very much. You can, for any questions, you can email at us at this address, and other informations or all informations actually that I discussed is available, whether as circular or as FAQ from our website. With that, good afternoon again. Thank you very much.